unfortunately, the way the reimbursement structure works, we're kind of, I think, not funded appropriately for that more upstream work. But again, we have a lot of levers we pull because it's the right thing to do. And I think the way, and it's not just a strategy around addressing people when they are already in their later decades of life and frail. So some of it is soft stuff, like in other words, just how do we influence? How do I make sure the brand of myself, the brand of Northwell, is pushing this concept of health and wellness, and we're already doing that. So we have some non-traditional priorities in food as health, and in education and career, and leads to financial stability and health. I think of the high school and the pipeline programs we're developing and all the work we're doing with the colleges, and the other social determinants of health, how we're forefront of that. But more importantly, what I love to see, and this is where I think the digital innovation, we're at a real inflection point, is I do think it's how do we empower patients, and Northwell is going through a big digital transformation, and this will be a priority for us. How do we truly partner with patients and put all the data, the tools in their hands, be very selective and proactive around helping guide them on their journey, and get more into, we talk about preventive medicine. I think it's also proactive medicine and more precision medicine. And I think if we watch the way the digital ecosystem will evolve over the next 5+ years, we take advantage of that in a ethically responsible, and we got to watch the boundaries of how technology is used, but there's so much power in that. And then I think that's where it's at. It's how do you really engage people? You see the stuff that comes out of the AMA and others, like 80% of health outcomes is driven outside of the, it's outside of the hospitals in the clinical arena. It's based on, again, the things we talked about, the fact that we have the largest obesity kind of statistics in the world, the fact that hypertension, diabetes, all these contributors to chronic disease have doubled or tripled over the last few decades in this country. Those are the things we need to tackle and be more proactive on. And overall, to your point, that long-term reduces the overall cost of healthcare, right? It reduces, hopefully, hospitalizations, demand for the higher end stuff, as people live longer but healthier with less of that high end, that more costly need. And it also addresses the fact that, you have aging infrastructure of hospitals in this country. People ask, are we going to have less hospital beds? I don't think we're going to have less. I don't think we have enough if we have the current number we have today with the demographic, evolution that we're seeing. So I think the way we optimize the capacity we do have for that growing potential future demand is we keep people healthier. So I think it's a cycle.